All right, so on to today's main event. The big, beautiful bill is a big, horrible reality for all of us. We're not here to debate it. We're just saying it's here now. What can we do, or what can we expect in terms of how this is going to impact our lives? As Coach Nicholson pointed out, a lot of the cuts are destroying the safety net and the fabric of the community around us in terms of how we care for each other. I've invited the people today who are charged with kind of navigating us through this mess. So we've got the CEO from Self Memorial Hospital who's going to be here and talk about how the pending cuts are affecting us now and what can we expect down the road. And we've also got the president of the Self Foundation that's going to be here to talk about how this is impacting the underlying charitable communities. And more importantly, what we can do about it. When I say what we can do about it, by design, a lot of the cuts are passed into law now, but don't kick into effect until after the 28th cycle, which means we have an opportunity to raise enough sand to try to get them to stop or repeal some of these things before the worst hits. But it all starts with us waking up and deciding now to stand up and speak up. So the whole point of today is to start educating you as to what we can expect in Greenwood, not just what's going to happen in the nation, what's going to happen in South Carolina, what's going to happen in Greenwood and what we need to do about it. I've got Ariel Best, who is also going to speak from an insurance perspective. We know a lot of people here get Obamacare. And we know that come December, there's going to be some radical price changes with that as some of the subsidies disappear. What does that actually mean to you? And if you can't afford health care, what does that mean to you? You know, now all of a sudden, we're going to be back in that situation where people are waiting to the last minute to seek treatment, and then that winds up being in the emergency room, which then causes problems for the emergency room and problems for the rest of us when we have an emergency and can't get in the emergency room. You see, it's all connected. So the idea this morning is to start walking down this path and understanding what the impact's going to be here in Greenwood. So.
Well, thank you. I'm Matt Logan. It's a pleasure to be with you all here, and I want to thank Mamie for inviting me to come speak to your group today. So I'm the president of Self Regional Healthcare. I've been in that role for about 4 years, right coming up on 4 years. I do see one of my bosses in the room, Miss Vanita Witt. She is on the Self Regional Hospital board, and honestly is phenomenal. Brings a really awesome perspective to that board, and chairs a couple committees and stuff as well. So glad she's here in the room with us as well. So specifically around the big beautiful bill and the effects that we're going to see here in South Carolina. So South Carolina, as you probably know, is a non-Medicaid expansion state. A lot of the provisions in the bill are directly related to Medicaid. Expansion states are significantly more affected, I should say it that way, than non-expansion states, at least early on in this. There are some specific things that cause you to have to do what's called redetermination, where every 6 months, like if someone is eligible or on Medicaid, they have to, it's almost like reapply or reaffirm that you're still eligible for Medicaid. Again, that primarily applies to expansion states, not South Carolina. The big things that we'll see here don't really kick in until 2028. Self-regional healthcare receives somewhere around $28 to $30 million per year through something called the Medicaid HAWK program, which is a healthcare program that's been in place for years that helps hospitals in South Carolina provide care to folks who otherwise may not get that care. That money starts getting reduced in 2028. And it's around, the estimates are currently around about 10% per year over a period of about 10 years until that rate comes down to just around the Medicare rate. But the impact on folks in South Carolina, specifically self-regional healthcare, is about a 10% reduction in Medicaid payments per year starting in 28, particularly around that HAWK program, which helps hospitals, frankly, stay open. Just to give you some reference, nonprofit hospitals like self-regional healthcare do not have huge margins. We shoot to try to get to a 3% margin, between 2.5% and 3% margin. Well, all that means is the money that comes in and the money that goes out, we make about 3%. We're not a huge margin business. When you start cutting into some of those revenues coming to the hospital, it affects what we can do for certainly the underserved, but frankly everyone in the community. It makes it harder to provide services. It makes it harder to buy the latest equipment and do all those things that we need to do. But fortunately, we have a couple years before that kicks in, and there's a lot of work, as you can imagine, going on, honing our operations, looking for other opportunities to grow our service offerings, to try to, again, to replace that revenue in other ways. So those are some of the things that we're working on right now. Part of the big, beautiful bill that was put in place to try to encourage other states or some of our Republican colleagues to vote for it that have states like South Carolina, they put in a provision, you've probably seen this, a $50 billion fund that will be distributed over a period of 5 years starting in 26. That money is going to be divided across the whole entire United States. Just to give you a reference, how much is South Carolina going to get? It's right around $100 million is going to come to the state starting in 26, and it's to be used specifically for rural hospitals to enhance care in rural America. And if you think about self-regional, we should qualify for that. The distribution methodology is currently getting worked on, but so for Greenwood, certainly Greenwood and the surrounding counties, so if you think about Edgefield County Hospital, which is part of our system, Abbeville Area Medical Center, which is part of our system, and self-regional healthcare right here in Greenwood, we all should qualify for some of that monies. What do we plan on doing with whatever we get? Again, we don't know what we're going to get. We plan on doing things to enhance healthcare in the community. It's not going to Matt Logan. It's not going to any one individual. It's going to be to improve the care for all in rural South Carolina and the areas that we serve. Again, self-regional healthcare serves Greenwood and the surrounding 6 counties. So that's kind of where we are with that. The methodology of that's not exactly determined yet. We have some upcoming meetings. The director of the South Carolina Department of Health and Human Services, her name is Eunice Medina, and I actually have a meeting next week with her in Edgefield County. We're meeting her down there. Will Gordon, who's our administrative officer of Edgefield Hospital and Abbeville Hospital, we have a joint meeting with her to talk about some of those things we would like to do in rural South Carolina and the effects that the big, beautiful bill is going to have significantly to us starting in 28. And what can we do now to try to plan in advance for some of those impacts. I think those are some highlights from kind of what's going on, or the potential effects here. Immediately, like right now, really no huge major changes, but those impacts do kick in a couple years down the road. What I might encourage folks to do, similar to what Alan's talking about, is when we get a little bit further, even right now, that is an election cycle year, right, in 28, and we think about what can we do. I imagine there'll be a ton of discussion across the country about health care, the impacts of this big, beautiful bill, and, who knows if there's a change in Congress, if there's a change in the president level, there might be a change in thought on some of those plans for the future, and maybe there's ways that Congress could enact something to stop some of these changes from happening. But as of right now, in 28, there starts to be about a 10% reduction in some of those state-directed payment programs, which is specifically will impact us right here in Greenwood, which starts in 28. I hope that helps. I'm not sure. I'm glad to answer any questions about that or really anything else that anyone wants to talk about at the hospital. I'd certainly be glad to talk about anything.
Actually, the way we'll handle the questions, thank you.
Sure.
We're going to go ahead and hear from the other two presenters first. Then we'll do the questions just like we did with the Senate campaign. There are cards on your table. If you have questions, write them down on the cards, get them to me, and then we'll ask them and have them come up and talk.